Hello, I am Erin Fobian. I am a professor at the University of Alabama at Birmingham in the United States, and I'm excited to have been invited here to speak about pediatric mental health, which is one of the issues that the Matruh Foundation is passionate about and wants to be able to address. And so I'd like to be able to explain some of the background of why addressing pediatric mental health is important. So, according to the World Health Organization, 1 in 7 10 to 19-year-olds experiences a mental health disorder. And this accounts for 15% of the global burden of disease for this age group. Depression, anxiety, and behavioral disorders are among the most common illness and disability among adolescents. And suicide is the third leading cause of death among ages 15 to 19 or to 29, 15 to 29. And so the consequences of failing to address adolescent mental health conditions extend into adulthood and affect adults in terms of their physical ability, leading to more heart disease, more physical disability, as well, of course, as continued mental health disability and emotional disability. And so it's really important to be able to identify and address mental health conditions when they begin to occur in childhood or adolescence. The condition that I focus on the most is called functional neurological disorder, and or FND for short. And so, functional neurological disorder is one of the most common diagnoses in outpatient clinics, outpatient neurology clinics, even though we've never heard of it very often. It consists of neurological symptoms such as paralysis, seizures, weakness, vision loss, and tics that are not the result of structural damage, but are instead automatic reflexes that the body has learned. These reflexes cannot be treated with medicine, but must be treated with targeted mental health interventions. And symptoms typically begin in adolescence or young adulthood. So I'm going to show you a few videos just to show you the impact that these have. These are publicly available in the medical literature in this publication over here. And so this is a patient that has functional seizures. And so this is a patient that has a functional tremor.
Left hand, I want you to follow my tapping. Okay? Now with the left.
And this is a patient who has a functional gait disorder, or like a functional, their ability to walk is affected.
You're again.
Okay. So in addition, FND costs families as much as 87,000 US dollars a year to manage, and it costs the healthcare system $1.2 billion every year. Additionally, individuals are unable to attend school or work, and 70% have to quit work. And this causes a significant financial strain on families. And although you may have never heard of functional neurological disorder, as many as 1 million people will be diagnosed with FND across the world this year alone. Despite the large number of adolescents and adults struggling to treat this, few therapists are comfortable treating FND since neurological symptoms are not something that mental health providers typically treat. Therefore, many therapists will not see patients with FND, and this results in an average of 3 to 7 years before individuals find FND treatment after they're diagnosed. And when therapists do treat FND, often they try to treat or target comorbidities such as mood, which don't help with FND symptoms. And so this is where my research comes in. I developed a treatment called retraining and control therapy, or REACT, and we use the precision treatment tool as an adaptive manual to be able to assist therapists in providing evidence-based precision treatment that's standardized and tailored to each individual patient's needs at each session. And so the precision treatment tool dashboard that is pictured here allows therapists to manage each of their patients, and therapists use interactive components of the tool to help tailor treatment to each patient. So we're trying to help therapists become more comfortable treating this so that we can have FND treatment become more widely available. And so the therapists use the tool during the sessions to provide a clear diagnosis of FND in the treatment, to develop individualized plans for the patients to retrain their physical symptoms. And it objectively tracks treatment progress, and then they can copy and paste information directly into the medical record to help with that. And the treatment is supported by research and has been shown to improve symptoms. Specifically, we found that patients experienced a 94% reduction in symptoms after treatment, with 59% achieving full remission for at least 6 months. 97% had a clinically meaningful improvement in their symptoms, meaning that this improvement indicated a significant impact in their quality of life. And 97% returned to school and other social activities afterward. Additionally, there was a significant psychosocial impact. They reported improved mental health, cognitive performance, quality of life after the treatment, and it also had decreased negative impact on the family. And so I'm excited that the My True Children's Foundation is passionate about pediatric mental health and the opportunity to be able to try to make a difference in this area. And so I really appreciate the opportunity to be able to speak. And if you want more information on React FND Health, you can go to this website, reactfnd.health, or to this QR code over here. And thank you so much.